Chairman LaHood, Ranking Member Davis, and members of the subcommittee, thank you for inviting GAO to speak at today's hearing. Today, GAO issued the final report in a series of reviews of TANF spending and oversight. And my GAO colleagues and I will discuss some of what we found with those reports and recommendations that we made to improve oversight of TANF. I will start by talking about trends and expenditures, and as also on oversight of state reporting on those expenditures by the Department of Health and Human Services, and then my colleagues will discuss other aspects of TANF. States have substantial flexibility to determine how to spend their TANF funds. The two most common categories of TANF expenditures are known as assistance, which covers benefits such as cash payments to eligible families, and non-assistance, which covers services like child care or employment training. And since TANF's beginnings, we've seen a move away from assistance spending towards non-assistance spending. In our recent work, we found that for fiscal year 2022, non-assistance spending accounted for about 44% of states' total spending, and that includes the federal TANF block grant as well as states' own contributions. In comparison, assistance spending accounted for about 25% of all TANF spending, and states spent the remaining share on things like program management or transfers to block grants. Likewise, we've seen an increase in the amount of unused federal TANF funds that states have carried over from year to year, which is allowed under the law. As we recently reported, and as you can see on the monitors, on the chart in the monitors, at the end of fiscal year 2015, states collectively had a balance of unspent funds of $4 billion. By the end of fiscal year 2022, that amount had more than doubled to $9 billion. And in fiscal year 2023, that amount increased again to $10 billion. Some of those unspent balances are funds that states have already committed or obligated but have yet to spend, and that's the light blue area on the chart on the monitor. But the bulk of the unspent balances are unobligated or not yet committed to a specific expenditure, and that's the dark blue area on the figure. HHS requires states to file various reports that provide information on their TANF expenditures, and we found some issues with those reports that could inhibit HHS's oversight of the program. HHS requires states to submit reports that include narratives describing certain types of expenditures, such as non-assistance expenditures. In reviewing these reports, we found that some states did not include the required narrative, and we recommended that HHS take steps to require those states, or rather ensure that those states submit complete narrative in their expenditure reporting. We also found that state reporting did not include detailed information on other aspects of states' TANF expenditures, such as their planned non-assistance spending. While current law limits what information HHS can collect from states, we recommended that HHS identify areas within its statutory authority where it can require states to report additional information. Likewise, we also suggested that Congress consider providing HHS with enhanced statutory authority to collect more information on TANF expenditures. And we believe that these steps could enhance HHS's oversight of TANF. Finally, previously we found that HHS does not report on estimated improper payments for TANF. And improper payments are those that should not have been made or were made in the incorrect amount. According to HHS, again, it's an area where it does not have statutory authority to require states to report the kind of information that it would need to estimate improper payments. And we suggested that Congress consider providing HHS with that authority. Chairman LaHood, Ranking Member Davis, and members of the subcommittee, this concludes my prepared remarks, and I'd be happy to answer any questions you have.
Thank you, Mr. Arkin.
Chairman LaHood, Ranking Member Davis, and members of the subcommittee. Today, I will be discussing two reports that we recently issued on the TANF program. The first looks at participant and outcome data that states collect on their non-assistance services and how they use that data to monitor and improve their programs. The second looks at the extent to which states use TANF to support their child welfare systems. As Mr. Arkin explained, state spending on non-assistance has increased as a share of TANF spending. Non-assistance can include anything that supports one of the block grant's four purposes, but within that, States have broad latitude in how they use the funds. And states have made different decisions about that spending depending on their priorities. As you can see in the graphic on the monitor, they use it for many purposes, including job training, education, child care, child welfare, and other services. But the question this raises is, what do we know about the participants in these programs? Who exactly is benefiting from TANF non-assistance funding, and how effective are these programs in achieving TANF goals? To get at that, we looked at the kinds of data states are collecting on participants and outcomes and how they're using that data. Our review of 7 states found that service providers, those at the local level, are collecting data on participants and outcomes. They're doing that to make eligibility determinations and to monitor program performance. Just to give an example, Ohio's largest category for non-assistance spending is childcare for low-income families. The state collects data on the income of the families to determine eligibility, as well as on outcomes for children like kindergarten readiness. Similarly, Texas uses TANF along with WIOA funds to support employment services. And as part of that, it tracks outcomes like wage growth and job retention. But that kind of data is generally not reported to the state TANF agency, and there are no federal reporting requirements for TANF non-assistance funds. So states reported a number of challenges in using data on those served with non-assistance funds. Challenges that hindered their ability to assess whether services were achieving their intended goals. For example, one state told us they collect data on participation in a marriage promotion program, but they can't assess whether the program improved marriage quality or duration. HHS technical assistance efforts have focused on improving data related to assistance rather than non-assistance. But individual states have identified promising practices for using data to help improve their programs. That's why we recommended that HHS facilitate information sharing among state TANF agencies on how they can better use data on non-assistance services. HHS agreed with this recommendation, but they have not yet implemented it. I'd like to turn now to states' use of TANF funds to support their child welfare systems, including addressing child abuse and neglect and supporting children who are in the foster care system. In a report issued this morning, we found that in fiscal year 2022, states spent $3.3 billion of their TANF dollars to support child welfare, 11% of overall TANF spending. I'd like to direct your attention to the map on the monitor, which shows the variation in how much states use TANF for child welfare. As you can see, while the majority of states spend less than 20% of their TANF funds on child welfare, a few, like Pennsylvania, spend no TANF funds on child welfare, while states shaded in dark blue, yellow, and red spend upwards of 40, 60, or even 80% of their TANF block grant to prevent or to address child abuse and neglect or to support children in the foster care system. Texas spent the most, with $417 million going to child welfare in fiscal year 2022. States also receive dedicated funding from Titles 4E and 4B of the Social Security Act for child welfare. But states told us they use TANF because it's more flexible and can cover costs not eligible for 4E reimbursement. We note in our report that our recommendation to improve TANF data collection efforts would increase transparency around the amount states spend on child welfare, as well as other programs. This concludes my statement, and I'm happy to answer any questions.
Thank you, Ms. Larin. Chairman LaHood, Ranking Member Davis, and members of the subcommittee, thank you for the opportunity to present our work regarding HHS's oversight of TANF findings in state single audit reports. Before I cover the results of our audit, I would like to start with an explanation of single audits. The term single audit is exactly what it sounds like, one audit of federal awards. Each year, states are required to undergo a single audit, which is conducted by an independent auditor and ensures that the states have adequate controls over federal programs and are complying with relevant program requirements.
Single audits also identify deficiencies that require states to develop corrective action plans. In a report we issued last week, we reviewed the most current single audit reports for each state and found that 37 states had TANF deficiencies referred to as audit findings. 22 states had at least one TANF finding categorized as a material weakness, the most severe category of audit finding, which can indicate critical risk and issues in the federal program. The reason for these material weaknesses varied by state. Some examples of the deficiencies included failing to collect and maintain sufficient documentation, lack of procedures, and lack of internal controls. We also determined whether states had the same finding year after year and found out that approximately 23% had repeat findings for over 2 years, and some have remained unresolved for more than a decade. For example, one state had a repeat finding for 15 years. The finding related to the state's lack of proper segregation of duties, which could result in someone having the authority to create and approve payments to ineligible applicants. Another state had 5 material weaknesses that repeated for 4 years, and one which related to an improper payment. The severity and persistence of these deficiencies indicated that states could improve how they administer the program, and that's where HHS comes in. As a federal awarding agency for TANF awards funds, HHS is charged with overseeing the TANF findings and to help the states resolve these single audit issues. We reported last week that HHS does not have sufficient audit resolution procedures. As I indicated earlier, some of these problems have been going on for more than a decade. Tracking and measuring the results of its single audit resolution process could help HHS focus on these repeat and severe deficiencies. Our first recommendation addressed this issue. We found that HHS did not issue many management decisions to states timely within the 6-month time frame as required. To communicate HHS's evaluation, and we reviewed 5 years of data and found out that HHS issued less than 10% of the management decisions on time within that 6-month time frame. We also found that HHS frequently issued management decisions late. About 23% of the decisions were issued late. We found one management decision letter for a state with 4 findings that was issued 4 years after the due date. At the time of our review, 2/3 of the required management decisions have not been issued. Timely issuance of management decisions is critical to ensure that states implement appropriate corrective actions. Our second recommendation addresses this issue. Earlier, I spoke about how single audits help ensure states are complying with relevant program requirements. During our audit, we found that HHS did not adequately ensure that it penalizes states for not complying with TANF requirements. For example, although HHS found several states that did not meet their statutory minimum work requirements, HHS did not follow its own procedures to reduce the amount of TANF funding to the states the following year. Without effective enforcement, HHS is unable to adequately encourage states to comply with legal requirements, resolve deficiencies in a timely manner, and reduce improper payments. Our last recommendation addressed this issue. This concludes my opening statement. I'd be happy to answer questions at the appropriate time.
Thank you, Mr.
Thank you, Mr. Chairman. Indulge my allergy voice. I appreciate that. Good afternoon to you, Ranking Member Davis, and members of the subcommittee. Today, I'll discuss GAO's January 2025 report on fraud risks in the TANF program. Annual combined spending on TANF totals over $30 billion, which is potentially at risk for fraud, making it imperative to manage risk effectively, especially since fraud risks for federal programs are heightened in the pandemic's aftermath. Fraudsters who hone their craft during this period are opportunistic, agile, and tech-savvy, and target programs such as TANF inherently at risk for fraud. Risk in such programs is a function of high spending levels, sprawling reach, and complex, often restrictive program architecture, which collectively could also hamper oversight. In this regard, noteworthy examples from Mississippi and California illustrate large-scale TANF fraud and other misuse. In Mississippi, according to the state auditor, multiple individuals involved with its TANF program, including the director of the state's Department of Human Services, potentially misspent, converted to personal use, or wasted more than $77 million in TANF non-cash assistant grants. In California, according to court records, several cases involve multiple criminal entities, potentially stealing about $200 million, impacting hundreds or more victims by using tech devices such as pinhole cameras to repeatedly skim EBT cards that access TANF cash assistance at ATM machines. With the foregoing as context, I'll make two principal points about our findings. First, HHS has taken some steps to improve its fraud risk management capacity. For example, it identified 21 fraud risks from various sources whose controls require improvement. We independently categorize these risks in 9 groupings, such as skimming and diversion, as shown on the dual monitors. And it also created profiles for such risk. Profiles function as a risk's DNA and help prioritize assessed risks and inform decision-making, including crafting an anti-fraud strategy. Second, these steps notwithstanding, HHS still falls short on 5 fraud risk management fundamentals, collectively undermining its capacity to manage fraud risks. 1, lacking formal procedures for conducting regular fraud risk assessments to keep up with the dynamic nature of risk in programs such as TANF. 2, omitting key stakeholders from these assessments. HHS did not consult its state and local partners in whose jurisdictions risks originate, as I mentioned in the 2 prior examples. 3, not clearly defining tolerance, likelihood, and impact for each of the 21 identified risks. This is vital for implementing front-loaded preventative controls. 4, ranking all 21 risks as being equal in requiring improvements in controls. This counterintuitively defeats the purpose of prioritized, targeted action, which is the hallmark of effective fraud risk management. 5, not assessing 3 additional and potentially significant risks, such as EBT card misuse, which we independently identified, and whose impact as enabling fraud is illustrated by the California example I cited earlier. Given these shortcomings, we made 7 recommendations to HHS. It concurred with 5 of these recommendations and partially concurred with 2 others. As of today, all of these recommendations remain open. In closing, I'd underscore that managing fraud risks effectively is serious business. While HHS has creditably taken early steps, it should prioritize fraud risk management for TANF and act decisively and timely to implement all of our recommendations to address the shortcomings we flagged. This will help ensure that TANF risks are mitigated and funds reach eligible beneficiaries rather than fraudsters. Chairman LaHood, Ranking Member Davis, this concludes my remarks. I look forward to your questions.